I'm Dr. Pre, and this is the Longevity Now podcast, where we distill insights from the frontier of longevity and preventive medicine to help anyone live healthier for longer. Hey, it's Dr. Pre. Welcome to Longevity Now. Super excited. I have an illustrious guest with me, someone who I've come to become really good friends with over the last year as we've dove together into the longevity journey. So I'd like to introduce Dr. Patrick Donovan, who's a doctor of physical therapy. He's the founder of Heather Lane PT, specializing in orthopedics and geriatrics. And he's been a physical therapist for over 10 years. He's come to really understand the functional physical needs as we age. And he's dedicated to empowering adults with a proactive approach to maximizing health span using cutting edge longevity science. Welcome, Patrick. How are you doing today?
Dr. Pre, thank you for having me on your show. I've really enjoyed getting to know you over the last year, and I'm honored to be here on your podcast, and excited to dive in, just kind of how you and I usually do, to some very specific topics with hopefully some implications that your audience can take away.
Absolutely. And I've been especially excited to talk to you, Patrick, because we got started on this topic because it's one that I know very little about and I'm not as comfortable with. And I think you really need hands-on experience to be able to tell and understand it to the level that you do. And that is keeping your physical functional health as you age. I think one of the big things that people really worry about as they age is they see folks who are older and don't seem like they can move anymore. I actually was just talking to a patient of mine the other day, and they were talking about their mother and how their mother is feeling like she won't be able to travel anymore and to walk with her grandkid. Her grandkid is in Europe at the moment. And I think that's one of the big things that people really fear. And it does seem like our general relationship with physical therapy is such that we wait till there's a problem until we go to physical therapy. So I love that you are really helping folks be proactive with this. And I'm excited to dig into it with you. There's a lot of places that we can go towards, but maybe I could ask you a little bit off the cuff here. What made you realize that, hey, I can really help folks get ahead of these problems as a physical therapist and really be proactive? Like, was there a specific patient, or how did this concept come to you to being proactive and more longevity focused with your PT practice?
Mm-hmm. Yeah, as you suggested, it is mostly post-surgical, post-injury, post-fall. You'd be sent to a physical therapist. But I had a in-clinic presence for about 7 years, and I was doing all of that. And found my real passion was working with people that wanted to get ahead and were doing things proactively from a maintenance standpoint, whether that's preparing for loosening a joint for surgery or getting ready for that hiking trip in Europe. Those were the kind of the training clients that I enjoyed working with most, that are older and they still have orthopedic concerns where they don't just want to lift a bunch of heavy weight, in a gym with a trainer. They can do a lot of those things, a lot of my exercises at home on their own with what you have around the house. And there maybe just the general nature of person I was connecting with was just like an everyday Joe, like Joe or Jane. They were not super active, not really going to the gym per se, but they're just regular people that wanted to keep traveling into their 80s, keep lifting their grandkids, but they didn't necessarily want to be gym focused. So that's really where I got involved. But that was, I, like you were mentioning, the older adult that you mentioned, we all have aging role models, whether they are good role models or bad, they still motivate us. So we either try to move away from being frail, and try to suspend frailty for a lifetime, which is kind of one of my mantras, is to try to never even meet frailty, which is, you need an assistive device to get around. You're needing help with everyday tasks. And then some people have really good role models for aging. For me, for instance, my grandmother was playing tennis with me into her 70s and beating me. So she was my doubles partner when I was like 10 to 15 years old. Uh, and we had a lot of fun. And I just never, I always took that for granted because I didn't know. But that's who I named my Heather Lane clinic for. That's the street she lived on. And yeah, she was, active into her 90s. So that's the role model that I have, and I think we should all, strive for that stronger role model than just the avoidance. But yeah, that's my mission is to have more people be positive aging role models for their younger kids, their grandkids, their nieces, nephews, just to see aging as something that we can be proud of, and it's something that's strong and resilient, opposed to that frailty concept.
That's awesome. I love that. And I actually didn't know that about your grandma. It's
Mm-hmm.
a really cool story. And we need examples like that. And I hope that we'll increasingly see more. One thing I've talked about with a lot of people, and maybe even with you, I read a story last year about a gentleman who's 80 years old and ran an ultra marathon, and not just any ultra marathon, but the hardest one. It's called
Mm-hmm.
Badwater, 135 miles in Death Valley, and he's 80. And that just really shocked me. And I think when we see these TV shows and hear about the blue zones in Okinawa, Japan, and there's one in California and there's another one in Nicaragua, you see these people who are like well into their 90s and they don't move like someone we expect into their 90s. I'm curious, as you started seeing these patients, were you surprised at how good their functionality was as you were working with them? Were they really able to make progress and gains in a way that, well, certainly maybe would be unexpected for someone like me, not having the experience that you do?
I mean, I try to meet people where they're at. If they've never been to a gym and they don't know how to do a hip hinge or they don't lift weights, we don't start with a lot of weights. We just start with body weight movements. And then 4 weeks later or the next appointment, we see where they're at again. And they might say, you know what, I can lift the 2 grocery bags that I have at home, and I don't really want to lift more. Or like, I don't want to go to the gym. So we just keep making the modifications that we need at home. That'd be kind of a lower level adult. I try to keep kind of age agnostic because there's out of shape 60-year-olds and there's ultra running 80-year-olds. So age becomes, yes, it's an important number, and people like to know what their physiological age is, which is, one of the services I provide. But then yeah, the people that are really in shape, like let's say they're a masters athlete, they go to the senior games every year, and I work with a gentleman who's a world record holder in his age group for swimming. So yeah, he's going to need some weights and bands and pretty much testing out as like an orthopedic client, not really even I think he's every 5 years as an age group. So I think he just aged up, and he's at like the bottom of his age group. And we're working on rotator cuff strengthening, rotational stability, all the same things I would work on with a 30-year-old. So it does depend on like where that person's coming in the door. And I do just try to meet them just because there's such a big variability. Uh, when you get a 35-year-old, there can be variability, but most 35-year-olds can climb the stairs and travel to Europe. But 65, 85, 95, that gets much more. You do have to make it more custom for that person.
That makes sense. And I'm curious. We'll get back to the younger folks. So 35, that's around my age. So I have a personal stake in some of the questions there.
Okay.
But let's say you have a 65-year-old who walks in who has never been to the gym like you just described. Do they tend to still be able to make progress? Right. Let's say someone out there is listening and they're like, well, I've never been to the gym. It's like too late. You hear a lot in longevity about how you can't reverse things. If you wait too long, it's too hard. But in your experience, do they still benefit from some targeted help with increasing their physical functional capacity?
Okay. Yeah. Yeah, the internal motivation to want to get better usually stems from some kind of goal that they have. So whether it's to go visit their grandchildren out east, or that they have to take a flight for, or they want to go do a hiking trip in Japan, those are that 65-year-old that's going to come in is going to be put on some kind of program, whether that's every week they want to come and see me, or I have this Capacity Compass product that it's a 30-minute evaluation, and they basically raise the floor on their 3 weakest links of aging. So whatever that may be, those are the most common things that are going to basically take them out of being able to travel in the future, and then giving them an 8-week program to work on those 3 weakest links. So that's what I'd start with, to get people a taste of what I do, is basically doing this functional capacity exam. It's a good introduction to my style and what I kind of stand for, to see if people want to keep working with me on a continuous basis, because it is kind of a tougher, when you go to a physical therapist, you kind of know what you're getting. You go into the physical therapy clinic and you're working on your balance or your back endurance or your knee pain. But when I try to be kind of the primary care doctor for physical health needs, which become more and more prevalent and important as you want to go on a trip to Japan, and you know exactly what those demands might be, but you don't know how to get there. It's a little bit more difficult than just showing up at the gym, because you do have chronic conditions, back pain, knee surgery. There's this whole physical health history that's kind of followed you. And I think a physical therapist is perfectly positioned. And the online format works for that kind of digital health coaching with specialties into orthopedics should they present, a bad ankle or a weak knee. That's all stuff I can address in a digital health platform.
Yeah, that's awesome. And I have some questions for you on the digital side of this later, because as we were talking about earlier, so the listeners know, you have now started a virtual practice, and that's super cool to me. And I really like what you're talking about with the concept of being a primary care for physical health. And another topic that you just brought up that I'd never thought about before is the history, right? Like having that physical history, almost like a movement, or I guess a physical capacity history. But yeah, let's dive into it. You mentioned your capacity compass. I know this is your kind of introductory, if you will, or maybe not, just like in general, like your comprehensive evaluation that you do with folks. And what are the different areas that you look at? How do you think about, you talk about it being a little bit like primary care, like what are the different segments of physical health that you think are important for that
Mm-hmm.
functional physical movement?
Yeah, I started kind of changing my basic evaluation when I had an in-clinic practice to to be shaped around these 6 metrics that help extend health span. So the amount of healthy years you have, that you're able to operate at the top of your game, and what those kind of groupings of physical health, chronic condition management, gait or walking. We know walking speed is so important for longevity. It's like one of the biggest levers that we never want to lose. Strength, mobility, balance. Is that 6? I think that's 6. And
Okay, so sorry to interrupt. Let me just make sure I got them all. So we have strength, mobility, balance, walking speed. What were
chronic
the other
condition
two?
management,
Chronic condition management
endurance, like cardiovascular endurance.
and cardiovascular endurance. Okay. Awesome.
So
Awesome.
that those became like my initial evaluation in the clinic kind of turned into capturing these 6 domains of health. And then I was able to just kind of translate that into a digital format, a virtual program. So the intake form lets me know, subjectively what they're capable of, and then that gets mapped into the objective measures that I take during the 30-minute assessment. We can dive into any of these you want, but like the inline lunge, the overhead squat, then there's some strength, 2-minute step test, 5 times sit to stand, all research validated tests, but I just kind of run through them through, depending on their ability and their goals. So the 65-year-old who's never exercised before might get a few different tests than somebody who's super high functioning and is going to the Senior Olympics every year. But yeah, I try to keep, there's tests that have come in and out over time as I continue to take on new information and continue my own studies. But yeah, the basic framework is capturing those 6 tests and then mapping them normalized to a scale of 0 to 100. And then depending on what you demand of your body, if you're just trying to go to the grocery store, that's a lot different than going on a walking tour in Japan. So that kind of reservoir of your abilities needs to match what you're asking your body to do. So I help visualize that and then create a plan to match your capacity to your goals.
Awesome. Well, maybe we can go through the domains. Let's start with strength because I think that's an easier one. I think typically when people think of strength, they're thinking about upper body strength. Do you like to look at both upper and lower body strength?
Yeah, unless they have really upper body strength goals, I usually look at just lower body strength, because in terms of, if they're having like a shoulder issue or a neck issue, or I see some things on their posture that would put a limit on their available like overhead strength, I'll mostly look at lower body strength. But yeah, the upper body strength is like a counter push-up, which gets progressed to a chair push-up, which gets progressed to a floor push-up.
And what's an example of a goal that somebody might have that relates to upper body? Because you said at the beginning there, if they have upper body
Mm-hmm.
goals, what are some that maybe you've heard from your older patients?
Yeah, I keep coming back to this swimmer that I have. That, swimming is an overhead sport. So
Mm.
that is that's not a good example for the capacity compass. He's definitely coming one-on-one for more performance orthopedic based care. But yeah, you think of reaching to the top shelf, uh, being able to have full motion with your shoulders for washing, and then traveling, getting your luggage into an overhead compartment is usually a good strength to keep.
Yeah, that makes sense. And for lower body strength, is it typically could just be as simple as being able to walk? Obviously, things like hiking Like what kind of other goals do folks tend to work towards? And part of the reason I'm asking this is a lot of the audience is a little bit younger, 40s, 50s.
Hmm.
And I think sometimes it's hard to fully think of, well, how bad could my functional capacity get? So I'm trying to get a gauge of what does like good what's a good lower body strength target for someone when they get into their 80s and 90s. Is it simply being able to get out of bed and walk? I mean, obviously we all hope for more than that, but
Yes.
I'm curious to from your experience, like what is a good target?
Yeah, I mean, working backwards from, say, my typical client is a 70-year-old female. So working backwards from that, if you're a 35-year-old man, it's keeping an eye on your arthritic symptoms, like making sure that your arthritis that's building up naturally as our cartilage breaks down, that you're able to work through a full range of motion, let's say in your knee. Um, like I wake up with knee pain. I've had 3 knee surgeries. That's going to be something that I have to keep on top of for the rest of my life. Like if I ignore it even for a month, I feel um, the swelling return. I have a Baker's cyst behind my knee, but like I keep all that in check by my own protocol, and anyone can, if you're so inclined, you can find that out for yourself. What is your protocol that works for your ankle or your hip, so that you don't wake up. I use waking up pain because that's kind of in terms of the clinical practice guidelines, like just waking up with a stiff joint is a strong sign that you have arthritic symptoms, opposed to getting an x-ray. So being on top of that, if you go for a long run or you lift like I had a guy I was working with who was younger, who had really sore shoulders after throwing his kids in the pool for a day. And he had basically just, he's only like 40 years old, but he had developed like a tendinopathy in his rotator cuff just from launching children all day. And yeah, it bogged him down for like the next 6 months. And then we got him on your body just doesn't bounce back like it did. So once you start giving your body the right impetus, it responds accordingly. So in his case, we gave him eccentric lowering and rotator cuff strengthening, some posture things as a desk person. So that was, in the course of 6 visits, he was able to basically return back to where he was. But, if he chose not to, then that tendon just continues to degrade, and you start to see some of the you don't see the effects for 10, 15, 20 years. So um, for your younger listeners, it's what parts of your body are talking to you already, how angry are they, and what can you do to make them feel better. And if you don't know what you can do to make them feel better, then you should call me because I can help you.
Well, for sure. We gotta give them some tips, give them some more tips like this.
All
So
right,
I think
we'll
a
get
big
some tips.
takeaway for me from what you just said and some of those examples is that it's not magic. It's not like it's over if you're starting to get knee pain like you are, or shoulder pain like this gentleman you mentioned in your 30s and 40s. There are things you can do to stay ahead of it. And of course, those are going to be more effective earlier on. So let's keep going through the capacity compass, and here's some of the other domains. So you mentioned strength. You could split into upper and lower body. Mobility was another domain, right? Can you
Hmm.
tell us a little bit more of like what does it look like when mobility goes bad, and what can you do to evaluate it and try to maintain it?
Okay. Yeah, one of the tests that I capture in my capacity compass, but it definitely relates to younger folks, is to be able to do a full squat, like butt to heels. And if you need, starting with maybe a 15-pound weight at your chest, and if you can't get all the way down without for me, I have this right knee, so I feel my right knee when I do a full squat. But by the 9th, 10th rep with the weight, that's called a goblin squat, you're starting to lubricate the joint. And yeah, it gets like I can just feel my right side getting more tired than my left. So you can find out a lot about your mobility just by way of stressing your joints to be fully open and fully closed. So when we walk, we need to extend our knee all the way straight. And that's basically the hardest part of walking. And it is the most common thing that I see when people start to get 70, 80 years old, is they've lost that ability to extend their knee because they've started guarding it because they've had knee pain. So there aren't, walking is kind of an easier task except for knee extension. So getting people to get comfortable in locking out their knees is a less common mobility issue for a 35-year-old, but it's definitely one to keep track of. Like when you're doing your back squat or your front squat, to extend your knees all the way straight so that those tendons and the joint tissue gets used to being in that fully locked position. That's something I look at on my testing. How are they shifting left to right? Where are they finding compensations? And that's all part of I've had a lot of clinical experience, and translating that to virtual has presented a few challenges, none of which have been like my eye for seeing asymmetries and poor movement quality. So that is an issue that whether you're 30 or 70, it's pretty obvious to a skilled practitioner where the mobility issues might be. And for my own, I'll just keep using myself as an example. Like when I do a back squat that's loaded up to like 165 pounds, I notice I start to have these same mobility issues that a 70-year-old would have with 10 pounds. And I think just seeing that, as I get weaker and older, and I carry being in an older body, that is what I'm kind of signing up for, is those mobility concerns, should I not choose to address them. So yeah, the mobility, another big one is the lunge. So I have people, if you can't tap your back knee to the ground during a lunge, one of the issues I see with a hip weakness is leaning forward. So if you're able to get your back knee down, but it's at a fault of your hip weakness, that is that's a common one that I see in my older adults, that is just as easy for a younger person to hold 25 pounds in each hand and do the same mobility test and to see how their quality is. I mean, that's one of the harder things, Pri, is people can get through a lot of these movements that I capture. But once we put weight on them, it's pretty glaringly obvious that they avoid their right knee, or, what's wrong with your left ankle that you're kind of showing some inversion signs. So those are harder things to figure out on your own, but easier for me.
Yeah, for sure. For sure. And this is, even my patients ask for this stuff, and I am not experienced enough to really be able to pick up on it, which is why I very much appreciate your expertise in this domain, because I think it's super important. Like a lot of things in longevity influence us, but certainly our ability to move. On the mobility side, it sounds like a lot of this is understanding your joint stability through ranges of motion as well as when loaded. Is that fair based on what you're saying?
Yeah. Step one is bringing your joints through their full range of motion. So if we're talking about the knee, that's that 15-pound weight all the way butt to the ground. You're bringing your knee like fully closed and then fully open on the way up. And then if you can do that comfortably without pain, without too many sounds in your knee, then you might move up to carrying a little bit of weight and seeing what your how your mobility breaks down or doesn't with loading the joint through the full range of motion. If you're that's this is all very much greatly geared towards extending the amount of quality years you have left, but I find it most applicable when people have a goal or a sport that they enjoy playing, and it's more exciting for me too to cater the exercises, the mobility demands to that sport. That's why you see like a gymnast is so much different in physique and body type than a football player. There's just very different demands on those sports, and that's no different between me and you. There's things that you and I want to do that are very different, that we might need different ankle I like to swim, so being able to get my foot completely straight is important for that flutter kick, but probably not important if you don't swim. So making those mobility demands, strength demands unique to your needs is always a fun part of my job.
Do you see a lot of mobility issues in shoulders? And I ask that because I'm someone who does not have the best mobility in my knees and my hips, and certainly my ankles, which I've sprained many times. But my shoulders have always been pretty mobile, at least I think, right? But this may be happening slowly and I haven't noticed it. I'm curious how often you notice that in shoulders.
Yeah. Yeah. And even when I'm working with young people, I notice, because you do need like some thoracic extension, like through your mid back, to get straight up. Like your shoulder joint gets about 3/4 the way there, and then the last fourth comes from this middle of your spine extension. So I see that posture issue as we become more, as you straighten up in your chair.
Exactly. I was going to say, it's like,
Yeah,
now that we're talking about it.
yeah. I think just having poor like hunch posture just makes it harder on your shoulder joint to get free in its ball and socket. So if you're all hunched over, that restriction becomes a little bit more obvious. But yeah, you don't really notice it until you start fraying your rotator cuff and your thoracic spine starts increasing in immobility. Then you need to lift that cast iron pot up from above, and that's when it's kind of like too little too late. Like you've already lost certain ranges. So yeah, being able to counteract our chair postures is a pretty easy way to get that full range of shoulder motion.
Got it. Got it. This is super interesting. Let's talk about balance next. What does life look like when you're 75 if your balance is not great? Like, what are you not going to be able to do anymore?
Well, when you're 75 or 80 and you're having trouble with balance, you're basically just spending more time worried about falling. More of your precious days are spent in consideration that, like, I'm not sure if we can go to that restaurant because I can't get up. I can't get. They don't have a railing for their stairs, so that's no fun. Like, I don't take it for granted because I work with a lot of people that struggle with balance and standing on one leg, that have poor reaction time, all of which can be measured and improved. But yeah, that can be disheartening to see people, they make decisions based off of like practicality, but it's really just fear, and they don't want to say that. Like they don't, or they have the ego that they don't want to use an assistive device, so they say like, I'm too tired to go, but really like they're spending their cognitive mind share on like being fearful. So what can we do when we're younger to prepare to never fall into that frailty The frailty metric is not being able to stand on one leg for 5 seconds. So that's like baseline for me. I work with people all the time that cannot do that, but being able to stand on one leg, 5 seconds, and then the upper threshold of that is 30 seconds. Granted, this is all for a geriatric population, but still for younger people, it's like, what can you do on one leg?
So you should be able to stand on one leg for 30 seconds at least, assuming that ability decreases over time.
Yeah, I stretch it even more for my younger people, which is on my intake. The question is, can you hop up one stair? Or like, what does it look like when you hop up one stair? So I can hop up, but I lose my balance. I can hop up, but need the handrail the whole time. I can hop up, no problem. I can't clear the stair. That is like A, B, C, D. So that's a balance test, just a subjective test that I gather just to get an idea of what, I get a lot of information. I get power, I get reaction time. Like, can they make that move in a short enough time that they don't catch their toe and fall? And then on the other end of landing, when you land on one leg, that's called dynamic stability. So being able to land on one foot and then maintain your balance without falling, that's the dynamic part, all wrapped up into one little multiple choice
And you put
question.
that all under balance the way you think about this. I know
The
there's
way for
compound.
purposes, yeah.
Yeah,
Yeah,
yeah.
yeah.
And
There's a lot. I think that's one of the, as I'm thinking about it, for younger folks, it's like there just begins to be more overlap between balance and power, which I would categorize as a strength metric. Uh, Same thing with like a 5 times sit to stand, which yes is a strength issue or a strength test, but it starts to become like an endurance. Like, do you have the muscular endurance to do that with a heavier weight? Yeah,
right.
so the
And
overlap becomes bigger.
and you're touching on something really important because as you talk about the example of the person who does not want to go to dinner because they're afraid of falling, they lose out on that socialization potentially. It causes anxiety. All of these things are interrelated. We know all of these things matter for longevity. Not any one of those is isolated. And even as you're talking about your movements, like doing a squat does include mobility, it includes strength, it includes endurance, which we could talk about, and it includes balance, especially if you start doing, say, like a one-legged, like a Romanian deadlift, I think they're called. I do them these days. Balance is one that's been on my mind because I, and this is really good unlock for me from a mental model standpoint. Used to think of it mostly as just injury prevention because we know that falls can be devastating as we age, but also just from a functional capacity standpoint, it and balance for me has been on the mind because I realized my right leg balance is really not great. Like I struggle to get to 30 seconds. And it's an interesting concept as you talk about the dynamic balance because if you wanted to do just static balance for someone younger and anyone listening, try this. Try this with your eyes closed. It is so much harder to do it with your eyes closed than eyes open. I would be impressed for folks to get to 30 seconds doing that in their mid 30s, maybe even younger. But certainly that hopping up to one step, like I'm going to try this right after our podcast here because I'm really curious about it. But that makes a ton of sense. And you mentioned endurance here, talking a little bit about cardiometabolic endurance. Maybe this goes a little bit into like the VO2 max that people are talking about a lot because there's good data around it. Um, what I guess I imagine it impacts everything, all of these movements that you're talking about. But are there any specific goals or functional activities that you feel endurance is more of a player in compared to strength or mobility or balance?
Yeah, my endurance test is basically, well, for older adults, it's a 2-minute step test with the rate of perceived exertion attached to it. So that's a subjective evaluation. But for all of us, we should kind of have a general idea of how many flights of stairs we can go up before needing a breather. So I used to live in a 20-story complex, and I would have to go up these flights of stairs to go to my unit, like 4 flights. And I could like, especially if I was on the phone, which is a whole nother like demand, I couldn't go 4 flights of stairs without needing to stop and take a break. And I would reckon that most people don't know how many flights of stairs they can walk up. Again, because I asked that on my intake form, and people are just like, I don't walk up 3 flights of stairs. But just knowing like when you get out of breath, and then if you're talking to somebody and when you get out of breath are great tests for like getting your baseline of your cardiorespiratory function. But yeah, the gold standard would be getting a VO2 max on a treadmill with all the gizmos. But I just kind of ballpark it with the subjective exam combined with the 2-minute step test.
What is the 2-minute step test? Is it just 2 minutes on stairs?
No, it's 2 minutes marching in place.
Got it. Got
Yeah.
it. And
And
like
I count.
knees high?
Yeah, you want to there's a certain threshold that your knees have to get to, but for the most part, you're just marching in place as fast as you can, as many reps as possible in 2 minutes. And then I use that to get your rate of perceived exertion zone, in which case I make like a cardio workout based on that test.
Is there anything upper body that you look at for endurance?
I used to do like a lightweight overhead press, just seated, like how many times can you press up a weight? But I found that most people, like unless it's specific to their trail demands, what they want to do in their life, I mostly have taken that one out, because most people need to do it one time. Like they need to just put their luggage up once. And that might be a 35-pound. It might be with both arms. I see people compensating quite a bit. Like if they have a torn rotator, one of their 4 rotator cuffs is torn on the right, they'll just use their left for everything. So it's not really I don't capture it in my capacity compass, but definitely like a one-on-one visit, we would work on that. I like the push-up, and then a plank. Like I'll do a floor plank or a chair plank, basically to see what their form is, like what muscles do they use, and then I kind of have a good idea from there how to make more specific exercises for that person.
Oh man. Yeah. That makes a lot of sense. And it sounds like that scenario, this is the one that I talk about all the time, getting my overhead bag in the airplane up into that compartment. That would be more strength and mobility than rather than endurance because it's a one rep, right?
Yeah. I used to, yeah, like I said, the one arm, I just didn't find like, in terms of extending people's healthy years, I was like, this is not worth the time. Like there's a different test that I should be doing in this 30 seconds. Because I run through like 21 tests in the capacity compass that make up those 6 links. So anytime I can save 30 seconds on a test is worth it usually.
Yeah.
Yeah.
That makes sense. And especially if it doesn't directly tie to their goals, then it
Yeah.
feels like it's less useful. And to your point earlier about motivation, if it doesn't tie to their goals, they may not necessarily stick with a training plan to improve that specific movement. Uh, Gait. This is one I'm really interested in. So I know there's a lot of good data around walking speed and longevity. Um, probably, I guess, health span as well, although I guess it's a little bit subjective. Do you find the gait evaluations to be not just academic, because it's one of those things that is kind of easy to measure walking speed, which sometimes, as you know, a lot of the data we have is around things that are easy to measure, like BMI is another one of those.
Yeah.
Do you think it's also functional and useful to have that information, or do you find it to be more of a research, we have good benchmarks type of metric?
Yeah, it is. There is good research. It is really important for longevity. We can, if I have somebody that walks at 1.1 meters per second, I kind of already have a pretty good idea of what exercises I can give them, opposed to if they are zero point 0.8 meters per second, that's like another tier down in their functionality. So it is a good, simple metric that gives me a lot of information as the practitioner. And it's one that, people really grab onto. Like, they understand walking is an important part of their life. Uh, I have kind of made it my own a little bit, where I like to do self-selected walking speed, fast walking speed, and then take the difference of those two as kind of like a different metric. Not as much data for that, but it is for me like how people, because some people, I have a lot of highly motivated older adults that want to get A's on the exam, but that really takes them down because they'll walk really fast in the self-selected, and then they can't walk much faster for the fast walking speed. So it gives me a little bit more information that maybe they were like exaggerating their self-selected walking speed. But yeah, that one's a tough one to extrapolate down to a younger folk, because that is not a performance-based metric that any 40-year-old really cares about.
Well, and self-selected walking speed, does that just mean you ask them to walk at a comfortable pace?
Yeah, I asked them. So for self-selected, the cue is walk like you're walking into the grocery store, like you're navigating actively parking, and how fast would you walk then? And then the fast is if you were trying to like walk across the street and catch a light or catch a bus, how fast would you be able to walk then?
Got it.
So
Got
there's
it.
like kind of explicit cues.
Yeah, that makes sense. Okay. Interesting. And I have to imagine, was you evaluate somebody's walking speed, you have to think about which of the other factors are holding them back, or are more of the root causes slowing down their walking speed, whether that be strength, mobility, balance, endurance. Is that how
Yep.
you think about it?
Yeah, totally. I think of Gait as like a composite of strength, mobility, balance. Because if you have, if you're starting, like, let's say you have let's say hypothetically you have right hamstring problem, I imagine you're going to be inadequate on your stride length on your right side. Like, you're probably going to be favoring that. And yeah, it doesn't matter when you're 40, but as that hamstring issue continues to age and calcify and scar tissue starts kind of doing its thing, that stride length gets harder to make symmetrical as you get older. Um, so yeah, like
Well,
noticing those things that limit your gait that you're walking is
that's what's
important.
so hard about this is the genesis of my a lot of my musculoskeletal issues are sprained ankles from playing basketball when I was a teenager and not fully healing them, not getting
Mm-hmm.
back to full range of motion. And over the decades, that's propagated. And this is a real risk with this stuff, which is why I do think that younger people should be evaluating these different dimensions, these different movement patterns pretty frequently. Otherwise, it's not just that you're not going to fix that issue that's there. You're going to generate other issues, and then you sort of have to walk back the chain and
Hmm.
say, okay, well, what's now I have three issues that stemmed from one. And now how do I go and fix it? I think that's what's so, I mean, it's all interconnected systems. It's similar in your last category, chronic conditions, which is a little bit more where I specialize. But I do love that you have this category because, of course, that matters. If you have devastating rheumatoid arthritis, it's probably not a lot you can do about your strength, mobility, endurance, balance, and gait. And so certainly all of these things end up being interconnected. And that's both, it's actually what I enjoy a little bit about longevity and why I really love having this conversation with you is because you get to think of all the different areas of, that create the system that is you as a human. And you really do have to think about them all and how they relate to each other. So it's a nice intellectual puzzle, but obviously it makes it very difficult to balance everything and maintain it. So let me ask you. I know we've talked about younger folks being a little bit of, and by younger, of course, we're not talking about teens. We're talking 30s and 40s and 50s. How often do you yourself evaluate yourself with your capacity compass, or how often would you if you were treating yourself like you treat one of your clients?
Well, it's fancy you ask because I'm training right now for a series it's a running race over the course of 3 days. That's 20 to 25 miles a day. So it's very challenging. Not really. I mean, it's hard for my endurance and my strength, but I notice my balance is the biggest thing that's like my weakest link because I fall a lot. Like some of these trails um, that this race is on and that I train on are fairly technical. So there's a lot of like fast feet and footwork, and nothing gets harder than like catching your toe and tripping. So I'm doing a lot of like a lot of reaction time, hip power. I'm doing things related to catching my balance for when I do catch a rock on my toe, which recently has been a little more often than I would like. And over the course of like a 20-mile race, that's definitely my weakest link. Not my knee pain, not my, I have like a little SI pain. My ankles get really tired, but for the most part, it's just like blunt force trauma from falling onto my elbow and shoulder. So I'm not, I'd say I'm like, that limitation is not captured in the capacity compass, but it's definitely something I coach people on and work on is reaction time for their sport. Whatever they're trying to gain performance gains. It can be, and that's not just for athletes. It's I trained a woman last year who wanted to hike the Inca Trail, and it was 3 days sleeping in a tent. She's 70 years old. She hasn't camped in 15 years. So there's a lot of different like cognitive stress, environmental stress of what the weather's going to be like and maintaining balance on slippery if it's raining. So yeah, like those things can all be trained for if you have the foresight and the practitioner with the right vision. I would have her come to see me after she climbed 100 flights of stairs and did her home program. So very, 3 hours of effort, I'd say, and then she'd come to physical therapy, and I would just see how wiped she was and how much slower she was, with her reaction times and her balance exercises. So all this stuff can be scaled up. Like it's not hard to scale up and down. It just depends on what you want to do. Like if you don't want to hike the Inca Trail, then you don't need to climb 100 flights of stairs. So making it unique to that person's goals is really like step one.
No, that makes a lot of sense. And I do agree with you that having a customized plan is key because it just works better. As I think about this, we throw out these words like bespoke and personalized and customized as if, I think it's good to remind ourselves that the reason is because it works. And ultimately the goal is for it to work. So let's take you, for example, as you're working on this. I know you're probably continuously checking in on yourself. Let's say I have a goal. Okay, I come to you. I say, "Hey, Patrick, I want to run an Ironman or compete in an Ironman. All right, I'm starting from almost nothing. Like, let's do this capacity compass, get the evaluation going, figure out my weaknesses here. At what point would you want to check in again and do it again? Would it be at the 6-month mark, the 3-month mark, or is that not really how you think of it?
Yeah, so the kind of the promise of the capacity compass is to have an 8-week roadmap to extend your health span and raise up your weakest links. But for somebody who's training for a very tangible task, whether it's an Ironman or the Japan walking tour, it's kind of taking those demands and that output and working backwards. So what do you need to be able to do the month before, 2 months before, 6 months before, and kind of tinkering with the program to be geared towards that output. I mean, that's not much, as the way you put it, it's not much different than like personal training or personal coaching. I think the orthopedic expertise that comes into it is how to continue on your plan while modifying it for your arthritic ankle or your surgically repaired shoulder. Like making those adjustments along the way with a skilled practitioner is kind of like the hard part in between, just like having a training program and assuming nothing's going to go wrong, which you might be able to get away with when you're 25, but every decade it gets a little bit more specific to you, again with the prior history of injuries and asymmetries, emotional, physical, mental trauma that you've been through. That's all can be carried into like your joints, your tendencies, your movement strategies. I've seen really stressed people who are just always tighten, and like the reason isn't, if I can get them to arch their back, but they can't do it themselves. And that's mostly like a mental, a motor control block that can take 2 or 3 sessions just to figure that out, which is painstaking. But yeah, like if you have the goal, we can get you there. But maybe the capacity compass isn't the best. You can just start with a one-on-one visit and kind of get the same idea of a roadmap.
Yeah, right. And no, that makes a ton of sense. And I'm just curious, like, let's say it's me, going back to me, no Ironman, which is not in the cards. But let's say that I simply am looking to continuously check on my different functional physical capacities and continue to improve them. So I'll give you an example. What we do in my clinic in Vita Veda is we do a really comprehensive set of blood work once a year, and then a smaller subsample at the 6-month mark. And if we're actively working on something, maybe you start cholesterol lowering medication, then we'll check that maybe every 3 months because we're actively trying to get it done. But then we'll do that broader evaluation again once a year. Now, you could do it more often. Brian Johnson does it once a week, it sounds like. And so there's not a one size fits all, but I think once a year, you'll probably catch issues before they start going in the wrong direction, and with enough time to change them in a way that is not just really difficult, right? They haven't gone too far off the rails. what do you feel like is a good cadence for somebody, whether it's through the capacity compass or not, but like is a good cadence to check in on your strength, mobility, balance, gait? Is it once a year? Is it once every 6 months? Just kind of your prototypical person, not
Okay.
necessarily focused on a specific area.
Yeah, that's a challenging question because people are always coming to me most frequently with a pain complaint, like knee pain when I go upstairs or when I downhill ski. Like their pain is their door to my like physical function programs. But for the regular, like for me, not if I wasn't training for a big race, I think once a year is an adequate. It's not maybe as often as getting your teeth checked every 6 months. Movement patterns take. You can change them momentarily, very quickly, but uh, they can get carried down the wrong path, like you were saying, for like your cholesterol lowering medication. You could, if you do the deadlift wrong for a year, then you might develop some things that regretfully you will wish you didn't. But hopefully you have some kind of pain feedback that would prompt you to seek expert help. But yeah, I think it also depends on like how serious you are. For somebody like you, I'm thinking every year we'd go through your capacity compass. I'd give you the things, the three things to raise your floor. Uh, you wouldn't need to work on them for a year, but yeah, like I could give you a few things that you could practice, especially like at a younger age. Like you do have more of a runway to improve your tissue mobility. Those plastic changes can take shape over the course of a year. Strength gains need 8 to 16 weeks to really start setting in. So that's what takes a little bit more hand holding. But yeah, if you're just checking on things once a year, could continue to raise your floor of those six components of extending your health span.
I was thinking every 6 months to
I
get
think you should
the
do it every week.
evaluation.
I like you on my schedule every week.
Yeah, yeah. Well, fortunately, don't quite have that kind of time, but
Yeah.
I think that makes a lot of sense, and I think that's really, in some ways, the dentists, and this is not meant to be offensive to any dentists out there. I have a lot of friends who are dentists, but the dentists, they got it down. 6 months, you come in for a cleaning. I mean, that is the standard. That starts from. I actually don't know if it's for children, but I feel like nobody really messes around with their oral and teeth health. Um, and they've done a really good job. And I don't even mean that from a commercial standpoint, but from a public health standpoint, generally speaking, teeth are well maintained. And I think that is a testament to a little bit of the system they've set up. And we in medicine, and we're trying to correct that now with longevity. And I think in some ways, the physical therapy world is even further behind, and probably the most far behind is the mental health world, which is a real interest of mine. But all of these are connected, like we were talking about. Um, I wanted to switch gears a little bit and ask you how the virtual practice has been going. And this is because it's a big interest of me, not just to learn about longevity and what we should be doing, but the access to longevity. And of course, there are some, I'm sure, real serious downsides to doing physical therapy evaluations and trainings virtually, in the sense that you don't get quite that same feedback, feeling a patient's tissue or showing them exactly what their range of motion should look like in an exercise. But on the other hand, you can reach a lot more people and get access to people who otherwise wouldn't be able to see you. Curious what your experience has been like in this, year or two that you started to do it.
Hmm. Yeah, I try to make I I don't know that I can speak to the accessibility as well, just because I'm kind of in it. Like I'm just trying to operate my digital practice. I don't have any numbers on how many people are interested in their health span. I can tell you I have a growing newsletter total that is telling me that more and more people are interested in it. So I try to deliver value through my YouTube channel, Facebook, and then mostly through free webinars that I host every month to my newsletter subscribers. So that varies on different topics. I think the most, people think of a physical therapist and they think movement, joints, muscles. So I generally have the most strong following towards those issues. But yeah, I want to be more involved in kind of the bigger decisions that help extend health span, which isn't necessarily like not having surgery, let's say like an orthopedic surgery, a knee replacement, hip, even elective reconstructive surgeries, is just trying targeted rehab first for 6 months. So most people come to me with pain and like a joint replacement is on the table. Like they're talking to a surgeon. They know if A, then B, they wake up, they have a new knee. And I don't know that that's necessarily worse for health span to have a new knee. I do know that I would rather keep and do everything that I can do to keep my own knee. And, that includes tendon, cartilage, muscle, none of the things that are captured with your knee replacement. So making it more accessible means taking matters into your own hands, because there are kind of current tried and true pathways which we saw like our parents do. And people following me or following you, working with you, and just taking that more seriously so that they can have longer vacations in various different places and not see their kind of freedom shrink as they get older. But yeah, the accessibility is tough because I only have so much time on my schedule. So I am trying to do more small group workshops, which are at a much more pleasant price point. And then I'm also productizing some services. So right now I have an osteoporosis program that's a course module, which is a great introduction into my style and format for systems-based thinking. But then also just one-on-one appointments. A 1 hour appointment will get you pretty far for the next 2 months. So I don't want to discount. I think it's very valuable to have a 1 hour appointment, but that might not be accessible for everyone, in which case, the newsletter, the YouTube channel, those are all great places to get a lot of this information. I think it's just to kind of elaborate, Pri, if you don't mind, it is kind of a nascent industry. I mean, that like these terms have been around for a long time, but there are more and more practitioners taking it seriously and finding audiences online. And it's important to be able to get through the marketing spiels and really get an outcome that you're desiring. So for me, it's all pretty, I try to be transparent in that I don't sell any pills or medications. I would love to. I mean, there's a big market for making money that way, but I would prefer people to use exercise and decision-making and information directed in the right direction to make better decisions about their health span. I realize that's kind of more of a longer term game that I'm playing, but I find it to be the most true to who I am in my own journey of extending my health span. So yeah, the folks that I find are generally skeptical of putting different things in their bodies, and they want to do whatever lifestyle modification is required. and I encourage that. And those are the folks that I'm trying to align my content and my vision to serve.
Well, I love that you are putting out the content because I do think it's really important for improving access, and that's part of why you're here doing this now. And we'll link to your Instagram, your Facebook, and of course your newsletter and your website. So I would encourage everybody to go and check that out and subscribe to it and check out one of your webinars. Um, it's funny. As we get deeper into these different realms, you start to notice other people doing what you do. So I see a lot more longevity doctors these days. But not being in the physical therapy world, I don't notice as much that there is a growing presence of online physical
Mm.
therapists, as with anything, varying degrees of quality. Uh, I'm curious though, as you have shifted to actually seeing patients online, are you still quite able to assess them and treat them? Like how much more difficult is it to do a one-on-one session with a patient online than it was in person? Do you
Mhm.
feel like you're losing a lot of your ability to be effective because you're not physically there, or has it been more seamless than you would have expected?
Yeah, the all the expect I mean the biggest problem is the tech is just like getting on and having an internet connection and a camera that works. Like that's the biggest hurdle. But honestly, like I think there's two other factors that go into this answer is I started doing virtual assessments during the pandemic. So I've been doing them for a long time. And when my clinic was shut down just for like 6 weeks, I turned everyone to virtual. And I asked people after they came back, they were like, because I hated it instinctively. I'm like, I want to get my hands on you and know where your movement is. Without your hands on somebody, you're kind of missing like a whole version of feedback. So you're not able to put them where you want them to, say, uh, find full flexion in their knee joint or finding ankle pronation. When you have your hands, it is a lot easier. But I asked people what they thought of the pandemic era virtual, and everyone loved it. Like no one noticed a decrease in care. So that's all I can, like, I was going off that. And then and I've enjoyed virtual as it's convenient, and I can say deliver 90% of what I would deliver, in clinic. But then this is more or less a gripe of mine, is that the standard of care for physical therapy in clinic has gotten worse and worse. As reimbursement goes down, uh, physical therapists are asked to do more with less. They're handing off treatments more to less skilled clinicians. You're going to be seeing different PTs on every visit. So there's a continuity of care problem. So for all those reasons, I don't find that the virtual care is that much of a step down. Uh, I argue that having 8 years of clinical experience in the clinic and then now transitioning to online has well suited me and my skill set for managing orthopedic and geriatric conditions.
That makes a lot of sense. Do you see or perceive a drop in results because you are virtual? Even if it's a slight downtick, like you said, you threw out the
Mhm.
90% there. I don't think that was necessarily in results, but maybe there's
Yeah.
10% of the scenarios where you're like, this would be a lot easier in person, outside of technical issues, of
Yeah.
course. But do you feel
Yeah.
like patients are able to recover at the same speed or improve their functionality at the same speed?
Yeah, definitely. Because what I lack in the manual treatment, I'm able to share a YouTube video that's like, hey, this is the movement I need you to try. And then Yeah. And a lot of my clients don't know any different. Like they know that they went to physical therapy and they're less satisfied with those results than they are with my hour-long session that, yeah, is out of pocket and it's not covered by insurance. But it saves them time for going, I like to, like, one of my slogans that I share in my webinar is you get the equivalent of 4 to 6 in-clinic physical therapy sessions in one of my virtual sessions. And I still think that's true, as it relates to like insurance-based care. Like
Well, and
I'm
I
compressing that
believe,
care.
sorry, I didn't mean to interrupt you, but from my understanding, having recently gone to physical therapy and actually asked my physical therapist many of these questions, the virtual care reimbursement is even worse, or in some cases non-existent. Is that
Yeah.
right?
Yeah, I didn't even bother looking into it. I mean, in my clinic, I took Medicare and Medicaid, so I'm very familiar with those reimbursement models. Uh, I I don't know, and it's another thing. I didn't really want to be a victim to whatever policy changes happen at Center for Medicare and Medicaid. If they just decide to stop reimbursing, then my whole business model is out the window. But yeah, I think it is just in rural health area, like certain zip codes, or I don't exactly know how that like rural health virtual care works.
Yeah. And for what it's worth, I think in every domain, in every industry, people who are better at what they do get paid more. That's just the status quo. And they don't get paid more. It's because they're delivering more value. You hear a lot about software engineers, the best software engineers being 10x or 100x more valuable than a standard software engineer. I think that it's in some ways good that the reimbursement models are not following. I mean, similarly in the longevity space, there's no reimbursement for spending 20 hours a year on a patient's care. It doesn't exist. And everybody who goes to their doctor knows you're getting an hour, like tops, maybe. And that's all there is, especially unless you're sick, of course, but we're talking preventive, proactive care as you are also doing. And I think the other advantage of virtual is that you can be found and accessed by people as a better practitioner that would not otherwise be able to. And folks may not know this about my practice, but I live in a state where I'm not even licensed. None of my patients live here, and I see patients in 5 other states where I am licensed, and I'm delivering a service that leads to better outcomes compared to a standard primary care, significantly better, not to mention better in other ways in terms of the actual experience that people have of that care. So that does make a lot of sense, and that's an interesting point of how the downsides of virtual physical therapy are offset by some of the upsides, as you described there. I hadn't thought of it that way, but that does make a lot of sense. And I got to tell you, as a patient, I do like the idea of not having to drive over there and be rushing and all that. And especially if I were living in a large city where the person that I want to see and trust is 30 minutes an hour away each way, which I'm sure happens all the time.
Hmm. Yeah,
So
people are. Yeah, I don't know that the outcomes I mean, we're just seeing, there's some recent research that came out that said that post-surgical rehab not was just about as helpful as just a take-home program for, let's say, your knee replacement. So I am less and less confident with the in-clinic model. I do miss like using my manual therapy skills. Like that was a big cornerstone of how I helped people find healthy movement. But I'm able to use just different techniques with online. Uh, yeah, and I'm using that to the best of my ability, as I'm sure you are. I mean, something I've appreciated about you is like you have kind of a systems-based approach for the the things that are going to kill you and trying to work backwards on that. And I love that, but it just doesn't fit in exactly with my strengths, abilities, credentials, permissions in the American healthcare system. So I will definitely be recommending people who are more interested in that, like primary care longevity approach to you. But for function, like I call it function first longevity. So being able to get up and off the ground, playing with your grandkids, these are all dependent on your joints, your muscles, your ranges that I think lend well to working with online.
Totally. Yeah. And I'm glad that the online system is effective because I do think that in a lot of ways we're better off solving the access problem first and then figuring out how to improve the quality than trying to do it the other way around. And I'm glad to hear that. And certainly I think there will be a lot more as time goes on in terms of different services that people can find, whether it's mental health, physical health like yours, just more general quarterbacking like I do, to try to stay healthy. And really, that's what everyone wants. And that's what this is all about. So, yeah, I really appreciate that you're doing that. I'm glad and I'm excited to see how it evolves. And so, I think we could wrap it up on that and say thank you again, Dr. Donovan, for your time, your expertise, sharing what you do and how you think about keeping people healthy, improving their health span proactively from a functional physical movement standpoint. The website is heatherlanept.com. As I mentioned, we'll link to that as well as your Facebook, your Instagram, and your newsletter. Any parting thoughts before we end this?
No,
And I'm
thank you
putting you on the
for
spot.
yeah, thank you for having me. I appreciate your audience for taking their long-term health seriously, and yeah, that's it.
Well, thanks for again for coming and sharing your expertise. I'm looking forward to getting some help with my bum rotator cuff and amongst others, which we didn't get to. But I'd love to do this again, and maybe we can get into some of the actual movements and showcase it there and get people a real taste of what virtual physical therapy looks like.
Yeah.